Good afternoon. My name is Greg Foster. I am the Nassau County Emergency Management Director. I want to spend some time with you today and every Thursday at this time to try to answer questions you may have about the ongoing COVID-19 pandemic in our community. We want to be the best source available for you in Nassau County for information concerning this pandemic, about which we are all tired of hearing, I know. But as we enter the fall and winter holiday season, we want to answer your questions about where we are with COVID-19 and what we all can continue to do to keep you, your family, and your friends safe and healthy. Our information will come from expert sources we have relied upon throughout the last 9 months, information from the Florida Department of Health that provides daily information about cases in Nassau County, the Centers for Disease Control and Prevention that conduct research and provide public health guidance, which has evolved as more is learned about this novel coronavirus. Our Public Information Officer, Dave Richardson, will be sitting just off camera here and to ask me questions. And hopefully I can give you very straightforward and accurate information that answers them. We want this to be informal, like we are talking with each other around a kitchen table. So bottom line, I hope this helps. Dave, what is your first question?
Director, thank you. We've all been hearing about, reading about the number of cases rising across the United States. We surpassed 100,000 cases in just one day yesterday. How are we doing in Nassau County compared to the rest of the state and across the country?
That's a great question. Nassau County, we've done very well with coronavirus. In the beginning, the first couple of months that the pandemic started, our numbers were exceedingly low. Obviously, if people are paying attention to the statistics coming out, during the summertime we had a surge of cases in Nassau County, bringing us up to our about what we currently are at. But with the help of the people of Nassau County, we've been able to turn that number around. The surge has gone down to amounts that are in the 5 to 10, a little bit more some days cases. Currently, our positivity rates are lower than the state of Florida's overall positivity rates, which in turn are lower than the national positivity rates.
What are we doing right?
Well, the people of Nassau County. That's why I have stayed in Nassau County for 27 years, is because of the people of Nassau County. They are paying attention to the information coming out from the Florida Department of Health, the Center for Disease Control and Prevention. They're taking the recommendations, and that's how we're going to continue to combat this, is by continuing to cooperate and comply with the information coming out of the Florida Department of Health and CDC, with social distancing, avoiding large crowds, staying home when you're sick, avoiding sick people, personal hygiene, washing hands, and then of course wearing a mask when it's appropriate to do so.
So we're doing better in Nassau County than other places, and it's because we're paying attention, right?
Correct.
But we have to continue to pay attention, right? Because now at 100,000 cases in one day, this virus is spreading across the country.
Sure.
What do we continue to do, and how do we inform people of the evolving changes from guidelines to what we are learning about this virus through this process?
Sure. The important thing to remember is the coronavirus is still here. COVID-19 is still an active pandemic within our community, within the state, within the country, and within the world. The most important thing is to continue to monitor the correct information coming out, be it from CDC, the Florida Department of Health, or us in emergency management, and comply with those recommendations that come out, and pay attention to the information that comes out. This is an ever-evolving virus. We're learning more and more as time goes by. That's the nature of a virus. And because of that, it's important to stay informed and realize what the current information and the current recommendations are.
Okay, it's flu season. And the general recommendations, what are they to get a flu shot?
As in every year, is recommended that people go ahead and get the flu shot. Obviously, It's recommended more for people that are older and people that are younger, but it is recommended that you get a flu shot because influenza is a different type of disease. It's a different type of virus. COVID-19 and influenza are two completely different viruses. Just because you've been COVID-19 positive does not mean that you're immune to influenza, being that they are two completely different viruses. So it's important to comply with the information that comes out every year from the CDC and the Florida Department of Health to take the influenza, the flu for this year very seriously because the flu is very dangerous also.
Okay, so we've had cases in Nassau County. People have tested positive. Should they get a flu shot? I mean, there are cases where we now talk about people who are long haulers, or it's been a long time since they've been contained, but they still are having different symptoms. Should those people also get a flu shot?
Sure, they should get a flu shot if that's what they decide to do, is to get a flu shot. The important thing to remember is that if you are currently under isolation for COVID-19, if you've been instructed by the Florida Department of Health to isolate so that you don't continue to be a spreader of the virus, then you need to comply with those isolation orders. Once you've gotten done with your isolation orders and that you've been released from isolation, then if you want to get a flu shot, then you're okay to go in for a flu shot.
Okay, so obviously we're talking about flu shots. This is have been tested, and everybody has heard we're testing from several different companies for a vaccine for COVID-19. What's the status of vaccines for COVID-19?
Sure, and that's one of those pieces of information that we want to make sure that everybody understands where we're at with that. There are several pharmaceutical companies, several companies that are working on a vaccine. The information that we're getting from the CDC and other sources is that they are continuing to test those vaccines, and it's anticipated that soon there will be a vaccine that will start being pushed out to the designated groups. We don't know what that soon means. It may be by the end of the year, it may be by the beginning of next year, but they are working on it and a vaccine is on its way out.
Okay. All right, so we kind of want to end this because we only want to do 10 minutes so
Sure.
people are not overwhelmed with all the information that keeps coming at them from all the different sources. We just wanted to have this conversation so you are a reliable source. We're going to do this every Thursday
Yes.
at this time. We're going to involve all the people, even if we get questions that need answers from county offices. We'll have somebody next week from the Florida Department of Health join us and ask some questions. But we hope this helps, and I'm assuming we'll invite people if they have a question to send it in to us.
Sure.
And then we'll try to get answers, and we'll do this again next week.
Absolutely. That's what we're trying to do here, is to help the people out there get the correct information. There's a lot of information sources out there that are not giving maybe the most accurate information. So we're trying to be that source of information so that people can get the correct, the most accurate responses to their questions so that everybody can be informed and help fight this, because we are in this all together.
Okay. Thank you.
Thank you.